Laura Martin. I'm the Substance Use Prevention Coordinator for Mayor Thomas Koch in the city of Quincy. Danny was 4 years older than me. He was the second out of four. It was my sister Ellen, my brother Danny, brother Mikey, and myself, so I was the youngest. We grew up in Braintree till I was in kindergarten. And then we moved to Norwell, which is a small, upper middle class town. And Danny he was definitely the class clown. He was a smart kid, but he had a lot of learning disabilities. And back then it wasn't really identified, so you just kind of were the outcast, like, oh, he's the clown. But he was very smart when he put his mind to it. Danny was very much the fixer. He kept things together. Being the oldest son, I think he felt a lot of pressure to, follow in my father's footsteps and take over his company and take care of my younger brother and myself and protect my older sister. Opioids began, I think, around 17. He was playing basketball. He was on JV, I think. He went up for a shot and he came down and he tore his ACL. And he went and had surgery. And back then, what you got was Percocet. And we have a strong family history of addiction. So all on my father's side, all on my mother's side. My father's 27 years sober, so we always knew we were predisposed. But the second that he got that, he said that he felt something that he had never felt before. All of his discomfort, all of the emotions that he felt, they were just numb, and he couldn't get enough of it. And so from 17 to around 24, he played Russian roulette, and pills were a big thing, especially in a small town, and we weren't talking about disposing of your pills after going to the dentist. He'd go and have a root canal and he'd get more, had a prescription for a long time, and then when that ran out, you had to go to the street. So that is what he did, and he kept it up. On the outside, he was best man in 3 weddings. He was a godfather. He never missed a family party, and then he went to Suffolk and graduated with honors. And then he was supposed to go to Suffolk Law School, and he died 10 days before he was supposed to start. Danny was sober from alcohol when he died of a heroin addiction, so he really caught on to his alcoholism being a problem, because that's what he identified with, my dad having been an alcoholic and him having seen alcoholism as a primary addiction. So he went and he asked for help, and he stopped drinking. But he didn't stop the other stuff. I think he thought that if he bandaged it and stopped the alcohol, then his craving for the others would go away. When you look back, it all made sense. The money, the missing things, the glassy eyes, it all came together, but he just personified everything opposite of what you would think of as a junkie. So around 23 and a half was the first time that he sought treatment. At that point, the options were very sparse. It was your typical, you go in for a 7-day spin dry, you get out, and you really don't have anything. I think he did okay for a little while. Then the heroin started around 24. And he saw how out of control things were getting. I remember he said he sat in the parking lot, and my mom was like, him and my mom were like, and he sat in the parking lot of a bank, and he had a check of hers that he had stolen, and he just cried, and he went in and he cashed it, and he said that's when he knew, like, he was gone. Like he said, he couldn't do 7 days and then be put out into the world. Like, he couldn't stop. He didn't even think he could do 30 days and be put out into the world. So he went to Quincy District Court to section himself. Now, he was supposed to be starting law school August 14th. He died August 1st, so 13 days. So he had no criminal record. He went up to do a Section 35 commitment, which back in that day, you really didn't see a lot of people self-presenting for a Section 35. So he went up and he asked the judge if he could go to Bridgewater, which at that time was the only locked facility. And the judge said, I'll send you to MATC, which is Men's Addiction Treatment Center. And he said, no. And he said, why? Young man, why would you not want to go to the better facility? And he said, I can leave. So he stayed there for 30 days, and that wasn't enough. But his time was up, So we came home, and he was home. Came home on Friday, and Sunday morning, my mom found him in his bedroom. So he died in his childhood bedroom. I graduated from Suffolk Law School in 2009. And I had always wanted to do the drug court. And I got a little bit of pushback because everyone's like, we don't really have an ADA assigned to that. You know, if you want to do that, that's fine, but you have to do your normal caseload. I was like, that's fine. So I kind of implanted myself down there and then became the ADA and just kind of stayed down there. And then as the specialty courts expanded, I kind of expanded with them. I mean, a majority of the cases that go through a district court are mental health or substance use related incidents. You see the progression from a young age. Like I see kids that I prosecuted as juveniles when I first started and now they're deceased. I think that it's probably the biggest public health crisis that we have ever encountered, and I think the scariest part is the longevity that's going to have and the impact. Workforce. I mean, you know, when pills were easier to get, people would be, it was, you know, you could be in the trades for 20 odd years and have a pill addiction without anything happening, especially a lot of the trades, a lot of labor. They've been impacted by this for a very long time, but now it's moving up and it's everywhere. It's executives, it's doctors. There really is no one immune to this, and the implications for the workforce are huge, but also for the family dynamic, for foster care, for DCF and those children's services, because what we have is grandparents or even great-grandparents, sometimes 70, 80, taking care of their grandchildren's children. So we have a 5-year-old. So we literally are going to have a generation of children that are going to age into the system because their caregivers are no longer going to be around. You look at it from a public health, you know, we've seen an outbreak in Hep A. The Hep C numbers, I mean, are astonishing. We also have an entire generation of children that are being born addicted. These kids are impacted in ways that we don't even understand yet. You're also seeing elder abuse. A lot of individuals, you know, taking advantage of their grandparents' pain medication, taking advantage of their grandparents' finances. A lot of domestic violence is increased with substance use. So it really goes all around. I'd been a prosecutor for about 7 years, and I loved it, but I saw that there was more to be done on a more systemic grand scale, and the mayor approached me because he was starting this new position. What I love about my new job is helping families in crisis throughout the community. I'm not a clinician, so I'm very clear on that, but I do have connections to people that are clinicians that can give people appropriate care. This is truly a systemic issue. It goes down into workplaces and how they handle people needing leave, into the medical community and how it's being handled. So I think that until it is treated like any other medical illness where you get exactly what you need for care until remission, I think it's still going to be stigmatized as some sort of a moral failing. I think one of the most impactful is I run a vigil every year on Overdose Awareness Day. And the police officers are there, but there's also police officers, fire, and EMS that are out there holding up pictures of loved ones. So, you know, it really, you can connect. And I think that vulnerability is something that police and first responders really were never taught. And the more vulnerable you can be, the more help you can give while keeping your professional boundaries. And I've just seen an amazing amount of vulnerability in our first responders. It's not about speeches. It's really about people telling their stories of loss, but also of hope. And that's probably my favorite. We call it, you know, the 8th annual Overdose Vigil of Hope and Inspiration. So it's supporting people that are lost and are grieving their losses, but also realizing that in those families where there's been loss, they're often affected by multiple cases of substance use in their family. So you want to give them some hope. And I think that's the best thing. Another thing, too, is realizing the ages. I mean, very young kids are coming to these things. And some people may say, well, is it inappropriate? And I think it's never too early for kids to learn, you know, that bad things can happen and that you have to be careful. And it's, you know, it's the best type of prevention is the real life examples of what drugs and alcohol can do, not just to a family, but to a community.